a Centennial story from the Portland Clinic. The start of the year 2020 found the Portland Clinic, with its 100 physicians and total staff of 600, working in multiple branches and 2 surgery centers, busy caring for 90,000 patients throughout the region. Oregon's first multi-practice medical clinic was approaching a milestone, its centennial year, 100 years of quality health care. That until late February, when the COVID-19 pandemic quite nearly brought things to full stop.
The next 2 weeks, a lot of uncertainty on everyone's part, the governor, healthcare in general, and certainly here at the clinic. When the economy started shutting down with the stay-at-home orders, that's when it really affected TPC.
And so a COVID-19 response team, comprised of medical and administrative staff leadership, began meeting early each day to plan and coordinate with all branches across all medical disciplines. The goal? To continue to care for patients while also protecting their safety and that of their providers, and taking the necessary steps to maintain the clinic's financial health during a fast-growing pandemic. It meant new safety measures, social distancing, mask requirements, and fever checks. Drive-in test sites followed. Then determinations as to what patients needed to be seen in person by their doctors and those who could be cared for through telemedicine, not a new concept to clinic leadership. In addition to telephone visits, and thanks to the quick work of IT staff members who needed only a week to launch an electronic telehealth program that would normally take months to install, physicians like gynecologist Amy Mulcaster would soon have virtual appointments with her patients.
So how are you doing?
I've been having lower back pain, but I don't know if that's just related because I'm sitting more because I'm more homebound.
Rebecca, I have a screen here with your chart to my right. So if I'm not looking at you, it's because I'm looking at your chart. I never thought I'd be looking at my patients at a computer screen and discussing their health issues, but I'm grateful that we have this platform because it's at least access and really, frankly, a way to engage with my patients, which you don't get that over the phone.
Serving also as the Portland Clinic's medical director, Dr. Mulcaster found her patients receptive to video visits, allowing her to see a dozen patients a day through telehealth. In only their first week of video visits, clinic physicians completed nearly 350 appointments. Some 3,000 telephone visits were also made over a 3-week period. But with Oregon's economy shutting down and its governor ordering a halt to non-emergency surgeries, the Portland Clinic felt a major budget impact. Its 2 surgery centers, normally responsible for 10,000 procedures a year, quiet. But even with expenditure reductions, staff furloughs, and the temporary closure of 2 branches, patients throughout the greater Portland area continue to receive needed care.
We also sought and received eventually some federal aid, which was incredibly helpful. But a lot of it really depended on the ingenuity of the staff to continue serving our patients through telehealth and other means.
And so the Portland Clinic's COVID comeback story continues, along with the likelihood that the combination of telehealth and in-person care will be permanent, and that still more changes may be ahead.
I think that we've shown in this last year, 9 months or now 10 months into this, that we are adaptable, that we can face a challenge, make decisions, and execute them in order to continue to do what we do best, which is take care of our patients.
Among those helping make such decisions, the Portland Clinic's Chief Operations and Information Officer, Shannon Deedy, who says the recent challenges will help determine future directions.
In these trying times, sometimes you think, oh no, we're contracting, but when I look ahead, it's really about expanding. I think that we have incredible things to offer patients in terms of the relationships that we build with patients, the trust that we have with patients, and so I think there's huge opportunity in growing our patient base.
CEO Dick Clark agrees, with one outcome being a planned move to a new flagship building in downtown Portland in 2024. There will always be challenges, he says, but while continuing to put patient care and doctor-patient relationships first, the Portland Clinic is more than ready to enter a second century of quality medical care.
The story is still being written about our response to COVID and what the permanent outlook is. I am very optimistic that the Portland Clinic will not only celebrate its centennial in 2021, but it'll also continue to thrive beyond that. However, we still have a lot of challenges, and we have a team of providers and staff that are battle-scarred and tested, and I believe that we can overcome those challenges.